Thank you for joining us here today at Trumbull Emergency Medical Services. February is American Heart Month, and we wanted to take the time to just remind everybody of a few small ways that you can take care of your own hearts and also help to save a life. A few of the things that we want you to remember is maintaining regular exercise and a healthy diet is critical to keeping yourself in good shape. Please do see your doctor regularly, control your blood pressure and your cholesterol levels, and make sure that you're aware of the signs and symptoms of a heart attack. If you do start to experience any type of chest pain, shortness of breath, feeling like you might pass out, nausea, vomiting, we do encourage you to seek medical attention and call 911 if appropriate. What we do want to focus on today is that you can help us save a life, and it's two very, very easy steps that you need to take. So if you do happen to be around and you notice that somebody next to you or with you is unresponsive or goes unresponsive, we want you to immediately call 911. Once you call 911, tell the dispatcher where you are and what's going on. And if the person is unresponsive and not breathing, you can start hands-only CPR. And that is the quickest and most efficient way to help us save a life. Today we're here to demonstrate what you would need to do when starting CPR. Really, it's just two easy steps. Once you've called 911, you're going to place your hands in the middle of the chest, right about in the mid-sternum, and push hard and fast on the chest around 100 to 120 times a minute. CPR is probably the one thing that is going to help us because when you start CPR prior to us getting there, you're helping to circulate oxygenated blood, which helps keep that patient with the ability for us to help get them back. Another really great thing that you can do is to use an automatic external defibrillator, or AED, if one is available. So if you were ever in the situation, if there's more than one of you available, have one person start CPR and ask another one to go find the AED. There are several AEDs in the town of Trumbull. We are a heart-safe community, which means all of our public buildings will have AEDs, and they are very, very easy to use. Barbara's going to show you right now. Even if they don't look like this, they all look fairly similar. They have instructions on where to put those cardiac pads, and once you press the on button, it actually has audio instructions, so it will talk you through exactly how to use them. You do not need to have had any formal training to use an AED, and the most important thing that you can do for someone who is in cardiac arrest, essentially they are not breathing and they don't have a pulse, is to place these pads onto them as soon as you can. So those are the pads right there. Barbara will show you where they get placed, but they do come with the pictures. So it tells you exactly what to do, and then you switch the machine on. The machine will actually tell you to pause CPR so that it can analyze a rhythm, and if a shock is advised, it will tell you how to deliver that shock, and once you do, you want to continue CPR again. Obviously, the first thing you do is call 911 so that we can come and then take these steps, and when we get there, we'll take over from you. But these two very critical steps will absolutely be instrumental in saving a life, and we encourage you all to practice CPR. If you do want to come down and learn CPR, give us a call here at Trumbull EMS, and we'd be happy to help teach you hands-only CPR and how to use an AED.